They are life-threatening, resistant to many antibiotics and treatments, and becoming increasingly more common.
In fact, doctors say the number of lives lost due to superbug infections is expected to increase by nearly 70% by the year 2050. Fox 13's health reporter Mandy Rock explains what is fueling this surge and how to protect yourself and your family.
A superbug is bacteria that's developed resistance to certain types of antibiotics. When many of us don't feel well, we go to the doctor and ask for antibiotics, even if we don't actually need them. Doctors say that's part of what's causing the superbug crisis.
It's a situation that we need to do everything we can to avoid.
More than 2 million people in the U.S. every year get infections that are resistant to some types of antibiotics. And more than 23,000 people die each year as a direct result. Doctors expect that number to grow.
We make better drugs and newer drugs that take care of those resistant ones, and then they adapt to those. So for decades and a century, we have been playing that cat and mouse game.
A new study published in the journal The Lancet reports from 2025 to 2050, the world could see more than 39 million deaths attributed to antimicrobial resistance. Infectious disease specialist Dr. Threlkeld says doctors' offices and hospitals are hotspots for superbug infections and can amplify their spread. But our own misuse of antibiotics hasn't helped either.
We have to get out of the mindset that everything needs an antibiotic, because many things do not.
As bacteria circulate, they can become resistant to multiple antibiotics, creating dangerous superbugs. But we can all help prevent the rise by taking antibiotics properly and only when needed.
And that's a conversation you should have with your doctor. Do I really need an antibiotic? How long should I take it? That sort of thing. And that really delays the process of the bacteria getting more resistant and getting the advantage.
Covering your health, Mandy Rock, Fox 13 News.